Hello and welcome everyone. I hope you are doing well. And I am Amar and I'm going to present 10 important questions on lead poisoning, which is the part 8 of Forensic Toxicology MCQ series. And those who don't know me, I'm the founder of ForensicMCQ.com. It is a platform where you get previous year question papers of NTA UGC NET and CUET PG exams. Apart from this, we have also made MCQs from three main important books of forensic science. First is Saperstein, second is Not By, and third is Richard Lee. Richard Lee majorly focus on the bio part or the forensic biology, and Not By and Saperstein focus on a complete introduction of forensic science. So without any further delay, let's move to the main part of this video, that is lead poisoning and their questions. So question 1. What physical properties is unique to metallic lead among pure metals? And here are the options. Option first, it floats on water because of its low density coefficient. Option second, it is soluble in gastric juice. Option third, it readily absorbs over skin. And option fourth, both first and second. And the correct answer for this question is option second, that is, it is soluble in gastric juice. So unlike other pure metals such as mercury, in case of let's say mercury or arsenic, so they are not soluble or not get absorbed, or the metallic form of mercury or arsenic is not absorbed by the GIT, or you can say gut. But in case of lead, it can easily absorbed by the GIT, easily absorbed by the GIT because it is soluble in gastric juice. But like other metal salts, organic lead, that is organic lead, is more toxic than inorganic lead. And it is usually universal in the case of metallic poisoning. So the organic forms of metal or metallic poisons are more toxic than inorganic poisons. So the correct answer for this question is option second, that is, it is soluble in gastric juice. Now let's move to the question number second. Question number second is a match the following question. So we have to match the forms of lead with its descriptions. So let's move to the A point, that is lead chromate. So lead chromate is known for its bright color, bright yellow color, and it is usually for making paints, and it is insoluble in water. So the correct match for the lead chromate is option second, that is used as chrome yellow in paints. So the correct answer for this is option second. Moving to the B part, that is lead sulfide. So lead sulfide is also known as galena, and it is the least toxic form of lead. It is least toxic. And the least toxicity is due to the two main reasons. First is it is insoluble and stable, and second is stable at blood pH. So the galena, or you can say lead sulfide, is the least toxic form of lead because it is insoluble and stable at the blood pH. So what usually happens is it is not get metabolized easily, not get metabolized by the liver easily, usually excrete out in urine without causing much harm to the body. And that is the why lead sulfide is the least toxic form of the lead. That is option 3. And moving to the C part, that is lead tetroxide, which is of red color, and it is also known as red lead, sindoor, or vermilion. That is option number 4. That is option number 4. And similarly to lead tetroxide, there is another compound of mercury, that is mercury sulfide, that shares the common name of sindoor and vermilion because of red color. But in case of red tetroxide, it is usually abandoned because of toxicity. So majorly, mercury sulfide is usually used as sindoor or vermilion. Moving to the D part, that is lead diacetate, has a sweet taste, and this is why it is also known as sugar of lead. Apart from sugar of lead, the other two names of lead diacetate is the Saturn of salt of Saturn, that is salt of Saturn, and Gollard's powder. Gollard's powder. So for option D, the first option from the description is the correct match. So the correct answer for this question is option second, followed by option third, followed by option fourth, and lastly option first. Now let's check the option. So option number second, that is second, third, fourth, and first is the correct answer. Now let's move to the question number 3. What are the two polymorphs of lead monoxide? And here are the options. First is green verdigris and blue azurite. Option second, red lethargy and yellow massicot. Option third, black galena and white cerosite. And option fourth, silver argentite and gold auric lead. And the correct answer for this question is option second, that is red litharge and yellow massicot. So lead monoxide, or you can say lead second oxide, presents in two forms. First is litharge and second is mascot. So litharge is present in red color or has a red crystals, while the massicot is yellow or the present in the form of yellow crystals. Moving to the litharge is usually made for the lead glasses, glasses and crystals, and also used for making ceramic glazes. So in case of ceramic glazes, they usually used as a fluxing agents. Fluxing agents. So what does the fluxing agent do? That it lowers the melting point of glaze and helps in making the ceramic glazes at lower temperature. Moving to the mascot, it has the massicot. It has a yellow color and usually it's used for making glasses and ceramic crystals. And apart from this, they are also used for making pigments. So the lead monoxide form of litharge and massicots are usually used for making lead glasses or ceramic glasses and also used for pigmentations. Apart from this, these two minerals usually differ in their crystal structure, and the litharge has a tetragonal structure, and in mascot, the structure is orthorhombic. Orthorhombic. And now let's talk about the crystal structure. So it represents the cubic structure where A, B, and C, that is the length, breadth, and height, has the same dimensions. But in the case of tetragonal, that is in the case of lithargy or litharge. So litharge has a tetragonal structure and it is of red color. So in this case, the A or E, or you can say the length or breadth is same, but the height is different. Moving to the orthorhombic, which is for the massicot. So in case of massicot, the length, breadth, and height are uneven. So the dimensions of A not equals to B and B not equals to C. So the length, breadth, and height all have different dimensions in orthorhombic structure. So this is the main difference in terms of crystal structure, and this is also the reason why lithargy is in the form of red color and the massicot is in the form of yellow color. So the correct answer for this question is option second, lethargy and yellow massicot. Now, let's move to the question number 4. What factors influence the absorption and toxicity of lead? And A, the presence of essential trace elements like iron, calcium, and zinc. And this is correct because the more the iron, calcium, or zinc in the blood, there is less absorption of lead because the iron, zinc, and calcium, or all these essential trace elements, cause competition with the lead because they share the same transport mechanism. So A is correct because these all three compete with the lead and decrease its toxicity. Moving to the B part, that is age with children having higher lung deposition rate than adults. And this is also correct because in case of children, the absorption rate is usually 3x or 3 folds as compared to adults in case of lung deposition of lead. So option B, that is also correct. Moving to the C part, that is the location of lead in the body, such as the bullet lodged in the tissue. And this is also correct because in case when the bullet is lodged in the body, then if the bullet leaches out the lead into the bloodstream, then it can cause lead poisoning. So option C, that is the location of the lead inside the body or such as bullet lodged in the tissue, is also correct. Moving to the D part, that is the method of exposure, with inhalation being more efficient than oral intake. And this is also correct because in case of inhalation, the absorption rate is usually 3 to 50%. But in case of oral intake, the absorption is usually 10 to 15%. So lead has higher absorption in case when they are inhaled, and it is also true for any metal. So option D is also the correct answer. So for this, all options are correct. Now let's move to the options. So option number 4, that is A, B, C, and D is the correct answer. Now let's move to the question number 5. Where in lead primarily stored in the body? So the question asks where in the body the lead is primarily stored. And here are the options. First is liver, second is kidney, third is bone, and fourth is brain. And the correct answer is the option third, that is bone. So in case of adult, the percentage of lead storage in their body is usually 95%. But in case of children, let's say children, this absorption is usually low, and which is around 70%. And in case when the lead is stored in the bones, it is usually stored in two forms. First is insoluble phosphate, and second is insoluble carbonate. And lead can stay in bones for 10 to 20 years. So it is a long time. So even a person that is exposed to the lead 10 to 20 years early, that can be easily identified by studying the bone or analyzing the bone and the lead concentration in their bones. Now let's move to the question number 6. And question number 6 says, how does calcium deficiency affects lead storage in bones? And in previous slides, I already told you how calcium, iron, and zinc affects the absorption of the lead. So in case when the calcium or iron or zinc is at higher concentration, then the lead or the lead absorption will be low. But this question asks about how calcium deficiency affects the lead storage in bones. So let's check the options. First, it increases the lead absorption from the tongue. Moving to the option second, it has no effect on lead storage. Option 3, it converts lead into more toxic form and cause acute lead poisoning. And option 4, it causes lead to be released into bloodstream. And the correct answer for this question is option 4, that is, it causes lead to be released into the bloodstream from bones. From bones. So, in case when the patient is suffering from the calcium deficiency, then in that case the lead deposits in their body or in their bone get released into the bloodstream. So, in case of calcium deficiency, there is a high chance of acute lead crisis because more deficiency of the calcium leads to the more release of lead into the bloodstream from bones. And to manage this situation, there is a chemical or a compound that is calcium chloride is used to treat such a situation, and it is usually administered through IV intravenous injections. So what does it do? That it causes lead in blood. So it causes lead in blood to get deposit again into the bones. So it reverses the effect of calcium deficiency. So the option 4, that is, it causes lead to be released into the bloodstream from bones, is the correct answer. Now let's move to the question number 7. How does the retention rate of ingested lead differ between adults and children? And here are the options. Option A, adults retain 33% and children retain 1 to 4%. Option second, adults retain 1 to 4% and children retain 33%. Option 3, both adults and children retain 33%. And option 4, both adult and children retain 1 to 4%. And the correct answer for this is option second, that is, adult retains 1 to 4% while children retain 33%. So children retain higher proportion of lead in their body. This is because of two main reasons. The first reason is lead mimics calcium. So lead mimics calcium. And the second reason is their digestive system. Digestive system is not mature enough. Is not mature enough. So it absorbs the lead as a nutrition. So in case when the children is usually less than 3 years old, then in that case the lead absorption is high because it mimics the calcium. And as the children is growing, this lead is usually absorbed as a form of nutrition by the children's body. So the correct answer for this question is option second, that is adults retain 1 to 4% and children retain 33%. Now let's move to the question number 8. Question number 8 says, how does the behavior of children under 3 years contribute to their lead exposure? And here are the options. Option first is onychophagia. Option second is bruxism. Option third is dermatophagia. And option fourth is pica. So before jumping to the answer, let's reevaluate all the options and what their meaning. So onychophagia, it is a situation or a habit of nail biting. Nail biting. Moving to the option second, that is bruxism. Bruxism is the habit of teeth grinding. So it is a habit of teeth grinding. Moving to the third option, that is dermatophagia. So dermatophagia is a compulsion to bite one on skin. It's a compulsion to bite one's skin. Moving to the fourth option, that is pica, and pica means consumption. Consumption of non-food items. Non-food items. So pica is the behavior that leads to the consumption of the lead by the children that are under 3 years old. So the correct answer for this question is option 4, that is pica. Now let's move to the question number 9. Question number 9 says Burtonian lines is associated with lead poisoning as. Now let's check the options. Option first says and the correct answer for this question is option A, that is a stippled blue lines on the gingival surface. So before moving to the question number 10, let's reevaluate what are the Burtonian lines. So Burtonian lines are also known as lead lines. Lead lines, and they are not only seen in the case of lead poisoning, but also seen in the case of other metals such as mercury, iron, copper, silver, and bismuth. So all these types of heavy metals can cause Burtonian lines or the blue lines on the gingival surface, but they are usually seen in the case of chronic exposure, that is small doses over a long period of time. So now let's check how Burtonian lines are formed. So first step is the deposition of lead over gums. So this is the first step. Now let's move to the step second, that is the production of hydrogen sulfide, H2S. So this is majorly produced by the bacterial action on the decomposition of food. So when the bacteria acts on the decomposed food or the food that is stuck in the gums or between teeth, then it releases hydrogen sulfide. And when these hydrogen sulfides react with lead, it forms a compound that is known as lead sulfide, and which is usually blue in color or dark blue in color or dark blue in color. And this is how Burtonian lines are formed over 30. Apart from this, Burtonian lines is very common and it is usually seen 50 to 70% of cases of lead poisoning and usually develop after a week or within a week, after or within a week. And the most common time is 6 to 7 days. So 6 to 7 days is the most common times where Burtonian lines are visible. And one more characteristics of Burtonian lines are that they are visible in upper jaw area. Upper jaw. So they are more easily visible in upper jaw area or majorly present in the upper jaw area of the human. So the correct answer for this question is option first, that is triple blue lines. Moving to the question number 10. What is the role of calcium gluconate IV in the management of lead poisoning? And here are the options. To enhance cognitive function, option second for bone strengthening, option third for colic relief, and option fourth as a prime chelator. And the correct answer for this question is option 3, that is the colic relief. So what is colic? Colic is a symptom that is usually associated with the lead poisoning and it involves spasm in intestine, or you can say pain in intestine, and it is very common. And it is usually seen in 85% of cases of lead poisoning, and the pain experienced by the person is usually spasmodic and paroxysmal. So spasmodic and paroxysmal means sudden and intense pain and intense pain. So in case of lead poisoning, person usually suffer from the colic pains or the spasm in the intestine, and it is usually very common, that is 85%. And the pain is usually sudden and intense. And one more characteristics of this sudden and intense pain is they usually last for few minutes only. They usually last for few minutes and mostly occurs at night. So it usually mostly occurs at night. So calcium gluconate IV is usually to manage the colic pain. So option three, that is the fourth colic relief, is the correct answer. With that, this presentation is ended, and I hope you have subscribed to our channel. And if you haven't subscribed, please subscribe. And I will meet you in the next video. Thank you.